26 years ago, I was a young physician in training here at NYU in Bellevue. In those days, it was not unusual for patients to stay in the hospital for many weeks. These were people with multiple medical conditions who were very, very sick and needed lots of tests to understand how to best heal them. I remember one such patient clearly. His name was Victor, and he was a man in his early 60s. Victor had multiple lung infections, sepsis, and many debilitating medical conditions. Victor had been in the intensive care unit for 7 weeks when my team took over his care. Now, back in those days, we used paper charts to keep track of our patients, and Victor's chart was 742 pages long. It contained years of blood tests, x-rays, CAT scans, notes from dozens of physicians, and hundreds of medication prescriptions. The information we needed to understand how to best treat Victor was buried in those 742 pages. Victor was critically ill, and we did not have time to go through it all and find that right answer. Seeing how important it was to find that right answer, and fast, I was convinced that there must be a better way. So after my physician training, I specialized in medical informatics, the science of finding and applying the right insight to the right patient at the right time from amidst a sea of data. Today, I serve as the Senior Associate Dean for Medical Education, and I direct the Institute for Innovations in Medical Education here at NYU. I've devoted my career to exploring how to use data, analytics, and now artificial intelligence to improve how physicians learn, diagnose, and make medical decisions. You might be surprised to hear that despite the many advances in science, new medicines, and new technologies, medical education and the process of becoming a physician have remained largely unchanged. If you walked into an American medical school 100 years ago, and most other medical schools across the country today, you would recognize the same overall structure instantly. 4 years of medical school, the identical pathway for every single student. Lecture-based classes packed with facts. High-stakes exams that focus only on memorization and recall. Medical schools are designed for the pre-digital era of no technology, no online textbooks, no Dr. Google, and certainly no AI co-pilots to help us. Everything has to be in your head to be useful. But it's a total disconnect. The world is rushing forward, and medical education is staying stagnant. So how did we end up in this situation? Let me give you a little historical context. The modern American medical school is based largely on the Johns Hopkins model. 2 years of foundational sciences, followed by 2 years of clinical training. In the early 1900s, this helped standardize medical schools across the United States and grounded them more firmly in the scientific method and academic medicine. And this was a good thing. But even that modern model of medical education is based on much older European traditions of medical school. In the 15 and 1600s, universities in Italy, Germany, and France taught medicine through the formal lecture, anatomy, bedside sessions, the apprenticeship, and the authority of expert faculty. That structure was revolutionary for its time. The problem is that many of those core assumptions from 400 years ago are still determining how medical schools work today. Now, that made sense when information was scarce and the amount of scientific knowledge was much less. But these days, that approach to medical education is a relic. Medical knowledge doubles faster than any human can absorb. There are 4,000 new medical studies published every single day. And in addition to the explosion in medical knowledge, we have all collectively experienced the amazing advances in artificial intelligence, which are already redefining what it means to be a physician. AI systems, medical AI systems, are now smarter than we are. Research has shown that when compared to human physicians, AI is often better at diagnosing a patient, coming up with a treatment plan, even taking a patient's history. In some states, AI is now allowed to renew patient medication prescriptions on its own with no human physician oversight. AI never sleeps, it never loses focus, and it can handle 1 or 1,000 patients like Victor at the same time. AI has the potential to be one of the greatest transformational innovations in the history of medicine, and its impact is already being felt in every corner of medical education and clinical practice. So this brave new world means that classical model of medical school, despite still being the norm, simply no longer fits the challenges and opportunities of modern medicine. We need to change. Here, we are taking action. We are redesigning our medical school around the best of what it means to become a doctor and also embracing AI. We have created an incredible ecosystem of data, software, and algorithms to train our medical students and faculty, and we call it Precision Medical Education. Precision Medical Education uses AI to customize the curriculum and pathway for each individual medical student, and it has allowed us to finally break free from that antiquated classical model of medical school. Our curriculum is now 3 years long instead of 4. Our students are more competent and successful than ever before, and they are using AI in their learning and in their clinical practice, doing so safely after having learned the skills on their own first. AI systems that we have invented here now automatically recommend educational resources and literature to our medical students based on the diagnoses of the patients that they're caring for, seamlessly integrated into their learning. Our internal medicine residents receive AI-authored coaching on every patient they admit to the hospital, improving the accuracy of their diagnoses and accelerating their development of expertise. It's an exciting time to be in medical school. Today's medical student is a mix of the passion, dedication to patients, and sense of obligation that has always existed, but they also have a growth mindset and a comfort with continuous change. They are learning early on when to play to their personal strengths and when to hand off tasks to AI teammates. Now, when I think about the future of medicine, I am not worried about AI making physicians obsolete. I worry about whether we will be able to redesign education fast enough to meet this moment. Because the question is not whether AI is ready, it already is. The question is whether we are ready to rethink what it means to become a physician. Let me leave you with 2 visions of the future. If we are ready, AI will be used to improve the lives of every single patient. Our physicians will balance the use of AI with human wisdom, and they will use limitless artificial intelligence to create a healthcare system that is light years beyond what we have today. If we are not ready, then doctors, patients, and hospitals will have less of a say in how these tools transform medicine. Technology companies may determine how healthcare works and how we communicate with our patients, and trust in the healthcare system could be eroded. Here at NYU Grossman School of Medicine, we are choosing to be ready, because the next patient like Victor should not have to rely upon a physician flipping through 742 pages, hoping not to miss something vital. He should have a physician who is fully present, fully informed, and fully supported by intelligence that never sleeps. Thank you.